this moment declaring a state disaster for all counties in the state of Texas.
Concerns are growing as daily lives are put on hold because of the coronavirus pandemic.
This virus is more lethal than the seasonal flu. Still, there's absolutely no reason to panic.
This morning, we're talking with Congressman Ron Wright of Arlington and Dallas County Judge Clay Jenkins.
This is Lone Star Politics from NBC5 and the Dallas Morning News.
Good Sunday morning. I'm Julie Fine from NBC5, along with Gromer Jeffers, political reporter with the Dallas Morning News. Hi, Gromer.
How are you?
I'm good. How are you?
It's been a tough week, but we'll all get through it.
It's been a tough week, and it could get even tougher. And this morning, we're talking about the coronavirus and its impact on everything from the political race to Congress and areas that affect you day to day. On Friday, Governor Abbott offering reassurance.
We made it through SARS, we made it through Ebola, we made it through H1N1, and we're going to make it through this together as well.
Joining us this morning, Dallas County Judge Clay Jenkins. Thank you so much for being here, Judge.
Thank you.
I know the situation is growing. What is the situation on testing?
The situation on testing is we're going to be able to dramatically ramp up our testing. Governor Abbott announced some of that at his press conference on Friday, and we continue to add to our capability at Dallas County. We are currently a large chunk, about over 30% of the state's testing capacity in state labs just in Dallas County at the Dallas County Health and Human Services. But with LabCorp and Quest coming online and others coming online, we should have the ability to test thousands here in the next, even in the next few days.
Can you be more precise than that? Thousands? What do you think the capacity will be?
Well, I'm talking, and by the way, when I say thousands, I'm talking about the entire state of Texas. Let me say this about the capacity. There will not be capacity for many weeks to test everyone who would like to be tested. We have the capacity and continue to grow it to test all those who fit guidelines and doctors request test from us. We are trying to build that capacity because I know a lot of people want to be tested. There is a misunderstanding with people on the testing that I can get tested before I have symptoms. You can, but you're almost always negative even if you're carrying the virus if you have no symptoms. So we're not testing asymptomatic people. A negative test on, say, the spouse of a person with coronavirus that was negative would not indicate that they didn't have the virus. We'd have to leave them isolated for 14 days to find out whether they had the virus.
How many people have you tested right now, do you know, in Dallas County?
It is, well, I don't have the exact number. I know it is, we have tested everyone that doctors have asked us to test. And hospitals have asked us to test, and we have enough capability to test a few more than that. But that number is, dozens a day capability, not hundreds a day capability.
And you want to get up to?
Thousands a day.
Thousands a day, okay.
No.
How long do you think that will take?
Well, it's a national effort, and we're leading the way locally. We're the first in the state to have the ability to test, and that's something we've worked hard on ever since Ebola, but it's not going to be around the corner, maybe 5-6 weeks.
So in the meantime, people, I think there's some confusion on should you go out? What should you do? Obviously, there can't be gatherings of more than 500 people, but what should people do that feel well?
Okay, so everything you do, you need to exercise personal responsibility and ask yourself, is it worth the risk? If you feel well and you're over 60 years old, you shouldn't be around groups of even over 10 people, okay? And there's one of the reasons why you want to avoid those large groups is if you go to a luncheon where there's 100 people and someone tests positive for COVID-19, you're going to be isolated, but for us to have to monitor 100 people at a luncheon as opposed to a family of 4 where I have to monitor 3 people, That will completely overrun our epidemiology or disease detectives capability, and we'll be a lot less safe when those things happen. And they will happen, but we need to try to stop it from happening as much as we can.
Ventilators. Do we have the ventilators to handle the possible capacity?
If everyone acts with personal responsibility, and I know we can because North Texas has proved time and again that they can do that. If they do that, and if we keep this out of the nursing homes and the senior centers, and we all play our part, then yes, we have enough. If we don't, when you're talking about 15% mortality rate in people over 80, a 10% mortality rate in people with a heart condition, there aren't enough ventilators in the world if this country, continues to act irresponsibly. It's unfortunate we blew our lead from China until now. We had a month, and people spent that time talking about it wasn't that serious. But here we are, and we've still got a chance to stop this, but it's going to take all of us working together.
You have any projections on how bad this can get in Dallas County?
If people don't act with personal responsibility, if people don't go well beyond the orders I'm laying out and act with personal responsibility in their individual situations, it can get very bad. And so I don't want people to panic, but I want them to understand this.
And very bad would mean thousands of cases. And
that can mean thousands of cases.
And how are your hospitals doing now, your emergency rooms? Are you handling whatever you need to handle at this point?
Yes,
are you concerned that you may be those hospitals may be flooded, overrun, and can't handle things if this gets out of control?
There's no hospital system that's set up to handle what is happening in Italy and what happened in China. Our goal is that doesn't happen here. Our hospital safety net is as strong as and stronger than most in the United States, and as strong as any. But this is the most uninsured metro area in the United States. We're one of the few states, and certainly the largest, that didn't take Medicaid expansion. So that means 250,000 Dallas County residents who would have access to health care are showing up at the emergency room at Parkland. This exacerbates what we're doing. That's why public health is a everyday challenge that needs to be dealt with in the legislature. Medicaid expansion, for instance, next time is absolutely critical to keep us safe. I've been saying that, and now everyone's unfortunately going to see it as we become the second county in the state to have community spread.
In the short time we have left, your best advice to anyone watching today?
Dallas County and North Texas, you can do this. You always rise to the challenge, and you'll rise to the challenge now. But it takes all of us exercising personal responsibility, staying calm and following the science, exercising good hygiene, and together we can do this.
Just in a couple of seconds, how long will your order stay in place?
That order's in place for 6 more days because that's the extent of the law. And if necessary, I'm confident that the Commissioner's Court will extend it.
Okay, thank you.
Judge, thank you so much. And up next, the coronavirus in Congress.